Welcome to another episode of Community Chat. My name is Kevin Tocci, and I will be your host for this episode. The idea of a particular show like this is to keep you better informed of so many aspects of our lives, especially here in the great town of Abington, whether we're talking with folks about upcoming community events, local issues, or even speaking with some of the elected officials about some of the things that are going on in and around the community and beyond. Today, we are fortunate to have State Senator John Keenan, who represents the Norfolk and Plymouth District. As he does on a regular basis, he comes in and talks with us about some of the things that are going on. Senator, welcome back to Community Chat.
Always great to be here. Thank you.
You got it.
Thank you.
How are things going for you? Here we are, late March, heading into April, town meeting.
It's a busy time of year. We're busy at the State House, busy out in the community, which is good because this job goes in cycles. So when it's busy, it's more engaging. You just feel more energetic. You feel like you're getting things done. You're out there meeting people, and that's the best part of the job.
I think congratulations goes out to you and your colleagues in the Senate. I know that there was a piece of legislation that there was a local individual who was part of the bill to enact for revenge porn. For folks who don't know, what are some of the particulars in this legislation when it comes to revenge porn?
Sure. So people will consent to having images taken of them nude, partially nude, perhaps even engaged in sexual conduct, and they'll do it within a consensual relationship. And then there are occasions when those images are shared without consent. So somebody may agree to the image being created, and then the image will be shared without their consent. In 48 other states, that's against the law. Massachusetts and South Carolina are the only two states that have not banned revenge porn. And so the bill, which had passed the House of Representatives, just last week it passed the State Senate, and we'll hopefully get it to the governor's desk pretty quickly. The bill would make the non-consensual sharing of explicit images against the law. And then we were also able to add to it, to kind of jump ahead of some other states, a deep fake component. So that when you look at revenge porn, somebody will take an image, they will share it without consent, they will do it to make money, to embarrass, to harass, they will do it through social media and other platforms, and the result is embarrassment, harm, humiliation, emotional distress. You can do the same thing this day and age with a simple image that's created through artificial intelligence. You could take somebody's face and then drop their clothes off by using a computer program and share that image, and people will think it's real. It's done for the same reason, perhaps for financial gain, to embarrass. It's done the same way through social media and other platforms, and the result is the same. And the results of this type of behavior are just devastating. And you mentioned that somebody local, Alex Hegarty, has been a real strong advocate for this. He experienced it. He's been very public about that. And his efforts have just been really great. He was there with his father in the balcony, in the gallery of the Senate when we passed it on the Senate floor. And I want to thank him, and I want to thank all those people who have experienced this type of behavior, who have survived it, and who have come forward to make sure that it doesn't happen to others. So we hopefully will be the 49th state to pass this. And we have also addressed the issue of deep fakes, so hopefully that's included as it goes to the governor's desk.
So I want to make sure I understand the trajectory. So it went to the House,
yes,
passed. It went to the Senate, it passed. Are the differences in the two bills, is it going right to the governor's desk, or is it going to a conference committee where they will kind of find a way to work through the differences to make it one united bill for her to sign?
The differences have to be reconciled. Whether that's done without a conference or a conference committee remains to be seen. My guess is it will go to a conference committee. The differences aren't great. One of the differences is that we recognize that young people make mistakes. And as they enter the criminal justice system, this legislation, this bill allows them to be diverted into an educational program. And those educational materials under our version would be developed by the Office of the Child Advocate. Under the House version, those educational materials would be developed by the Attorney General's office. So it's something like that that we have to reconcile. We both have the same process, the diversion process for young people. It's just who will create that curriculum. And there are some other changes as well, nothing really significant. We, in the bill, also redefine abuse to include coercive control in relationships. Our abuse statutes generally focus on physical abuse, but we know with social media and computers and tracking devices, you can control somebody without physical abuse. So our abuse statute's been will be updated by way of this bill to include coercive control, and we apply it to 209A restraining orders, and the Senate also added it to harassment orders, and that's a difference between the House and Senate version of the bills as well.
And do you know how many differences are there? Do you feel this is something that can be remediated relatively quick, or is this something that you might have to watch for the end of the legislative session?
I'm hopeful that it'll be done quickly. The House had passed this bill unanimously last session, and the Senate passed it in an informal session last session, near the very end. So there wasn't a chance to reconcile the two bills. Okay. And Representative Jeff Roy from Franklin, who's the House sponsor of the bill, we were basically of the opinion, give us 15 minutes, we'll hammer this out. And I'm still optimistic that if we're able to sit down and work it out, that's what it will take. Whether I'm on the conference committee or not, I think the differences can and should be worked out pretty quickly.
Okay. Let's talk about another situation. It's becoming basically a public health crisis, and that is gambling addiction. Nowadays, you can't listen to a radio program, you cannot watch local TV without seeing advertising for any of the notable organizations that want you to go online and gamble. If you want to parlay, you want to bet on this game, bet on that game. I know that it was one of those things that the Commonwealth of Massachusetts, I want to say that the particular online betting, I know that we were able to have casinos first, and then there was an amendment to that gaming legislation to allow for gambling on sports. Now it seems as though this is becoming an issue.
It's spinning out of control, I believe. And I've always been of the opinion, no matter what it is, that adults can kind of make their own decisions, yes. Whether it's whether they want to drink alcohol, use cannabis, gamble. Adults can make those decisions. I've always been concerned about the impact of these things on young people and the efforts by, for instance, the sports betting industry to target young people, to make advertising appealing to them. We saw it happen with tobacco and the vaping industry, where they just went right after young people. We're worried that the sports betting industry is doing the same thing, not as in as obvious a way. And so we're really focused on that. And just yesterday, the Attorney General, Campbell, had an announcement that she was joining with the NCAA and the Mass Gaming Commission and a bunch of other organizations to really promote education among young people about the dangers of sports betting. Charlie Baker, former governor, was there in his role as president of the CEO of the NCAA. And that's great. I think all that is important, but it's not enough, in my opinion, to just say this is dangerous. We have to make sure that they're not constantly exposed through TV ads to all of this. And it's something that's catching on among young people, and I'll give you a quick example. I was in a local school district yesterday, a local high school, meeting with students, and somebody asked me, what do you think of the NCAA tournament? And I said, my favorite team is Marquette. Two of my sons went there. And he says, are you betting? And I said, no. I said, I'm watching it because I enjoy it. And then it gave me the opportunity to talk a little bit about the dangers of sports betting. But that a person in high school asked me whether I had bet, and asked me with a sense of enthusiasm, is really concerning. That it's clearly sports betting is having an impact in reaching young people, and we have to do everything we can to avoid that. All the data, all the science shows that the younger somebody is when they first start betting, or at least are exposed to it, the greater likelihood that they will end up with a problem, a gambling issue. And so really the prevention is the key, and a big part of that is limiting their exposure to this.
Not sure as to how big of a sports person you are, or what sport you may or may not follow, but we had the latest rumblings of the Japanese pitcher,
yes.
Pitcher hitter superstar is now with he went from the Los Angeles Angels to the Dodgers, Shohei Ohtani. Knowing that this is such a global figure, and that there is some kind of issues, they're saying it's the interpreter, but now there's questions about other things now. Any concerns as a local elected official when you see a figurehead like that, who is part of a big news story that people of all ages who follow sports might take an interest in?
Hopefully, in that case, they'll take the interest in realizing that it's dangerous, and this could, impact his career, as it did with Pete Rose, who was betting. Just recently, there was a basketball player in Toronto who they're looking at him because there was some abnormal betting practices at Temple University. They're looking at that. And so, yes, I am worried. And they'll see those cases, and hopefully it'll be a warning to them. But in the meantime, they're hit with local sports figures on advertisements saying that this is a good and a great thing. And that's what's concerning me. I was watching a Celtics game the other night, and in the upper left-hand corner of the screen, the odds came on as to, I think, the over-under on points. And there it was, and kids watched those games, and then the commentator on the game said, oh, I don't know if I agree with that. I think the other team has one more run left in them. And so they're not talking about the game, they're talking about the sports action, the sports betting action.
In-game action.
In-game action. And there's Charlie Baker has proposed not to allow bets on individual performances of college athletes. And I think that's something we should do. We should look at it for professional athletes. We're hearing these stories now more and more about how college athletes are pressured on campus, with coaches are pressured. And some coaches in the NBA and elsewhere revealing that if it's a 20-point game, they might put in the subs. And they said literally people will come out of the stands, stand behind them and say, you're costing me money. What are you putting them in for? What are you putting them in for? We're hearing it across the board, professional and amateur sports. And we've got to get this under control.
Something else that's kind of related to it, and that is that the state has a main fund that helps kind of combat gambling addiction, whether it's with public service announcements or maybe having somebody who is recovering from gambling going to schools. The governor is considering cuts to that because we are tough fiscal times right at this particular moment. A lot of our revenues aren't meeting their benchmarks, so you got to make adjustments. What are your thoughts on that?
I think what she did was she did it in recognition that we're in a tough financial situation presently. And I think she looked at the account that money would go into, and she felt that that was sufficient. My feeling is that it's not sufficient, that there's so much work that we have to do, that we need as many resources as we can. We fought last session to get an amendment in the budget that would allow us to do some study of what's going on out there. We met with the public health data folks, and they said, rather than a one snapshot study, which New Jersey has done and Connecticut has done, their feeling is that we should start doing monitoring of sports betting practices, who's betting, get all that information and use it to inform us when it comes to policy. And so, and that's expensive. And so as much money as we can get to do this, we should. And we're a state that has a pretty low tax on the sports betting industry. Other states have it as high as 50%. And so when people say, well, how would we pay for that? Well, sports betting companies are getting a pretty good deal in Massachusetts. They're making a lot of money. And we could do something in terms of what the assessment is on them. It wouldn't cost the bettors, the general public, anything. It would just mean a little less coming out of their pocket, and use that for prevention, for education, for all the surveillance of public health concerns, all those types of things.
Let's shift our focus from gambling to drug consumption. I believe that you've had a chance to kind of do a little bit of studying regarding supervised drug consumption sites here in the Commonwealth of Massachusetts. You and I have had an off-camera conversation about it, and that this is something that I think is practiced in a couple of other states. Is that true?
So it's been in use. They've been in use all over the world for quite some time. In North America, they have been used in place up in Canada. In the United States, there is one in New York City. There are two in New York City, operated by the same entity. And Rhode Island has just approved an overdose prevention center that may open at some point during the summer. So over the course of a few years, knowing that this would become an issue, I traveled to the sites in Canada and in New York. Did it on my own, essentially, literally got in the car one Saturday and drove up to Montreal. I had meetings scheduled with those that run the operations, but I like to, my practice, my MO, so to speak, was to go a couple days early and just put myself in the community where these are located, see what was going on, observe the comings and goings, make an assessment about the impact on communities. I literally sat on bus stop benches, walked through parks, walked down alleyways, sat outside these places at sunset and as late as 1 o'clock in the morning in Montreal, literally standing in a doorway.
No, wait, Old Montreal or New Montreal?
It was right off downtown. It was in the downtown area. The one that I was there at about 1 o'clock in the morning. Yes, I don't know technically what's old or new.
Okay.
It wasn't in the old.
I did a couple of, we went last, a couple of years ago, me and the missus, and I love Montreal.
Yeah, it's a great city. Yeah, so this was, I guess, in kind of newer Montreal. It wasn't in the old
Yep.
city part of it. And so did the observations, and then I met with law enforcement, the people who operate these facilities. And my sense was that if they're done right, they can be put in place without negatively impacting a neighborhood, and put in place in such a way that they save lives. And they also save costs when it comes to our healthcare system. And so there's legislation in Massachusetts that would create a pilot program. And my feeling is that if a community wants to do this, not required, but if a community wants to open one of these, that they should have the ability to do so. And we could use that as a pilot program, collect the data, get the science, use it to inform us on policy, find out whether they work, and I think they will, or don't work, or are there certain issues that have to be addressed based on what we would learn. So if a community wants to do it, I support legislation that would allow them to. And we have some communities that are interested. Somerville has been moving through a process. Worcester's Department of Public Health has said that they would like to open one in Worcester. It's not a fit for every community because there may not be a need or a critical mass of people who are using drugs in the community, but in some places I am convinced that they can open safely, not impact the neighborhood, save lives, and save costs in our healthcare system.
It's interesting because we want to do away with drug use, but in a way this makes sense because, as you said, it saves resources, whether it's ambulance trips, personnel that have to be there to hopefully revive that individual, and maybe if they had taken a drug that Narcan could revive them, you'd have somebody who would be right there. Any pushback from any of the police unions or any of the supervisor unions in regards to something like this to let someone legally do drugs with illegal substances?
Yes, so it's novel here. There is curiosity. I've spoken to the local police chiefs, the police chiefs of my district, and I'd say it would range from curious in the sense that we've tried so many other things, and yet the number of people dying from overdoses seems to be increasing, to the thing that you say was, I don't know, are we enabling people? And those are all very legitimate questions and concerns. And in my mind, when somebody says, are we enabling people, I go back to some of the photographs that I took, some of the images that I saw, for instance, in Vancouver. And there are some people who are so deep into their addiction that we're not enabling them. They are going to use drugs because they are so addicted. And so making sure that they have a safe place to use them where they can go, if they overdose, they're revived. You don't need police, fire, ambulance. You're not spreading communicable diseases. They're not sharing needles with people spreading HIV or hepatitis. And then the hope is that the relationships are built and that they move from using the Overdose Prevention Center into treatment. And I can tell you when we visited the center in New York, we saw that. We were there, and a person who had been going there literally said, I'm ready. And they were there to help that person get into treatment. And so it's keeping them alive to the point where what happens, what we hope will happen for everybody does happen, where they go into treatment and they get into recovery. That's the ultimate goal, obviously. So much work to do on prevention, but for those in the throes of addiction, let's keep them alive and give them a chance to enter into a recovery program and to move through that.
What is Joint Rule 10 Day, and how does it affect you?
So we work on a 2-year legislative cycle, and in the second year there's a date, and I can never remember what the date is, although it's always looming as we go through the session, where the committees to which the bills have been assigned have to make a decision on those bills.
Yep.
To report them out favorably, to send them to study, which means basically they're done for the time, or to seek an extension order so that they can do further research and refinement of the bill or further review of the bill. So that Joint Rule 10 comes, and a lot of bills are reported out favorably, some are sent to study, some are extended, and so your hope is that your bill is either extended or that's reported out favorably so that you can continue to work on it and get it to the House or the Senate floor. So that date has come and gone, and we're at the stage now where we're paying closer attention to fewer bills. There's over 7,000 bills, near 7,000, between 6,000 and 7,000 bills that are filed every year. And so this prompts the committees to make a decision on them, and then it allows greater focus on those that we think will advance.
Anything notable you want to share in regards to any bills that you may have in part of that process?
Yeah, so we have some bills in healthcare finance that will continue through having to do with parity, insurance coverage in the broad sense with all of those types of issues. We've got a couple of transportation bills. We've got a series of bills that have survived that we'll focus on, and there's some that we think should have gone through. Like we have a bill that would seek to extend insurance coverage up to 30 days for people in substance use treatment. That was not reported out favorably, but we keep nonetheless trying to find vehicles for those types of things. So it's a broad range of our bills that are still out there. There's one that has to do with off-peak charging for vehicles, for instance, that we're hopeful will start to move through the process. And so you just try to find these other bills that you can either detach things that have been sent to study to, or you try to push your standalone bills to maybe be attached to a bill that's likely to move forward too. So we're a lot of work to be done between now and July 31st, which is the last day of our formal sessions.
Anything in regards to any other State House news or anything that you want to share as to things that you may have attended up on Beacon Hill?
A lot going on. When you think of day-to-day matters, it's just a constant stream of people into the office, which is great, which is the best part of the job. You learn something new every day. Last week, or this week, we spent some time on the Ways and Means Committee. I chaired a meeting of the Ways and Means Committee, the Joint Committee, along with Representative Haddad, and took testimony from people. The budget is going to be quite challenging this year. Our revenues are below, for the current fiscal year, what we estimated. We've modified our estimates for the upcoming fiscal year, which we're now planning the budget for, and it's going to be a very tight budget year. All the indicators are that it'll be a short-term time of challenge, that we'll get through it pretty quickly, but nonetheless, it's the time to step back and say, okay, what are our priorities? How do we best want to fund them? And where are our revenues going to come from? The governor introduced her budget. The House will do their budget in late April, and we will do ours in May. And we're closely watching the revenues in the current fiscal year to see whether that's going to prompt further cutbacks as we plan for fiscal year 25.
Well, there were already conversations about 9C cuts across the board, but I don't know how dire they were, because again, we're dealing with the migrant situation, trying to assist individuals who are new to the country, who are either seeking asylum or a new start in life, and we are a state that open arms when it comes to allowing folks to come here. So do you feel that's going to play a role in the 2025 budget, is helping those individuals get acclimated to the Commonwealth and becoming citizens?
We just passed in the Senate a supplemental budget bill that puts funding on a schedule, that we will fund at a certain level. I think it's $75 million per month to the end of the current fiscal year. And then there are decreasing amounts as we go into the next fiscal year, with the idea that will force the governor to make decisions with the legislature as to how to best address the situation. And most of that money is coming from a reserve that we had. So it has not had a direct impact on the current year budget. It should not have a major direct impact on next year's budget, but it will have an impact. So we've got to continue to address that problem. And in terms of, I know a lot of people say, well, we should put a residency requirement on our emergency shelter program, our emergency assistance program. We should put a limit on how long people can stay there. We have essentially shut that off, because the governor has put a cap in place of 7,500 families, and that has been reached. So there really isn't, the word is that we don't have the ability to house people in our emergency shelter system any longer, but they still keep coming. And so that's why we have people at the CAS Center, the courthouse in East Cambridge, and the governor's talking about a location in Chelsea. So they still keep coming. And until the federal government addresses the issue at the border, and that is not only physically at the border, making sure we have proper staffing there, but also, in terms of people who are applying for asylum, working them through the system more quickly, getting them the proper paperwork, getting them their papers to work. We've had some success in Massachusetts in that there are a lot of people who have come through the asylum program who are now working here and contributing financially to the Commonwealth. They have jobs, they're paying taxes. So we have to accelerate that process, because my experience has been, almost without exception, the people that come here want to work. And we have over 200,000 unfilled jobs here in Massachusetts. Well, twice the number of people we have unemployed. And so we desperately need workers. These people want to work, these folks, so we want to get them their working papers. And that really eases the financial pressure in terms of the impact on our budget. But the federal government really holds the key to a lot of this. Will they finally address the issue on our southern border and in terms of asylum and immigration in general? We're hopeful that they will. They had an opportunity with a bipartisan bill, and that went nowhere. And it would have done things like put more justices in place, more border agents in place, all those types of things.
Okay. Let's talk about the district. Probably the top thing on the list would be St. Patrick's Day Parade.
Yes.
Abington's annual celebration of St. Patrick's Day.
I had the opportunity to get a picture with St. Patrick himself.
Oh my goodness.
Yes, who was on the parade. It was a great parade. It was, I think, more crowded than anyone that I can remember in the recent past. The weather was nice. Usually there's some spots during the parade where the number of people on the sidewalks watching, there's not as many. It seemed like the whole parade route was crowded this year, and it was great. It's always exciting. You get the chance to see people, give quick waves, catch up, run over and say hello to somebody. It's a great event, a long tradition, and the whole parade committee, what a job they do.
Anything notable as far as anything else in the district that you want to mention? Let's not forget, we're having this conversation just a couple of days prior to Abington town meeting. Is it that season where you kind of are attending town meetings or attending council meetings to talk about the finances of the Commonwealth?
Yes, we've been before the Rockland Select Board talking about finance of Commonwealth, talking about civil service. I was just down last week at a Hanover Planning Board meeting to talk about the MBTA Communities Act and accessory dwelling units. I'll be at the Abington town meeting Monday night. I'm not sure when this will air, but I'll be there at that. So there's a lot going on in the towns. We met with, I met with Mayor and folks in my office, met with Mayor Joyce in Braintree recently to go over the financial situation there. So pretty much in every community, we just left Holbrook actually over there with some library folks talking about library issues. So there's something going on in every community, it seems like every night of the week. So it's been busy, but again, it's just great to get out and talk about issues and meet folks.
If there are folks who want to either catch up with you at some of your office hours around the district, or if they have any questions, what's the best way for them to find out that information?
Yes, so they can reach us at 617-722-1494. We always have somebody that picks up the phone. They can email us at john.keenan@masenate.gov. We have a newsletter if they want to go onto our website, which is senatorkeenan.com, senatorjohnkeenan.com, or just Google it, they'll get to us. There's a place where they can see what we're up to. They can also request to go on our newsletter where we kind of summarize each month. And then we also hold regular office hours. We do a cycle where we'll do them at senior centers, then we'll, during the day, then we'll go and do libraries or town halls at night. And we try to publicize that through our social media on Facebook and on X now. And also in the local papers on their electronic websites or in the actual print edition. So, and I'm also available to meet somebody at a coffee shop individually. We do that all the time, rather than have people traveling to Boston. If they want to travel to Boston, we love that. I'll give them a tour of the State House, but locally happy to come out and sit at a coffee shop and meet with folks and go over whatever issues they have. Anything
that we haven't talked about, but you want to take a moment to touch upon for our viewers?
I guess I'd say this, and we're in pretty challenging times right now, and over the course of the next several months, the presidential race is going to continue to draw increasing focus and attention, and I just urge people to keep it all in perspective, that's national politics, the difficult times, and just to focus on friends and neighbors and family, and not letting the politics impact relationships that we have with our neighbors, our friends, and our family. It's so important that we recognize we all have, and everybody says this, but I think it's so true, so much more in common than what it is that separates us or distinguishes us. So let's just get through this, be rational, reasonable, and keep those friendships and those relationships that are so important.
Senator, as always, I want to thank you for joining us and making it a regular thing to kind of talk to the folks here in Abington and keep them up to speed as to some of the things that are going on up at the State House or within the district, and that you're on top of it.
Great, thank you, I appreciate it. Thank you for allowing me to come in and meet and get the word out.
I want to thank you for tuning into programs like this. If you have any questions or any ideas for topics for our community chat, send us an email at info@abingtoncam.tv. And until our next conversation, have a nice day.